I am Dr. May. This is Stella. Stella has a condition of malocclusion where her teeth do not meet up properly. Her mouth is formed abnormally, and so we're going to spend some time working on her teeth so that she'll be able to eat better. These are all teeth. 2 or 3 different teeth that are going all kinds of different directions on the bottom. So that's the right lower molar area. And there's really too many teeth there. We may end up seeing if we can remove one of those. So we're going to try to level those all out so that we have a nice flat mouth instead of a stair-step kind of fashion. There's a loose tooth here. One of these teeth that's growing in a funny direction is actually loose. We're going to end up pulling it. Too many teeth here, and it's getting infected actually. Well, sometimes it's swelling, not eating, the same things. Oftentimes there'll be a swelling of the jaw. I didn't appreciate a swelling on her jaw, but she actually does have a little swelling around that set of teeth. So these teeth are probably all infected here. This is an elevator. This is what we're going to slide down around the tooth and see if we can loosen it just a little more. One of the hard parts with rabbit teeth is they have very long roots, and so it's sometimes where you end up breaking that root off. A little bit of cheesy stuff, so we do have a little infection around that root. I'm not sure any of these teeth on this side are going to ultimately be much good because I think they all may be involved in this infection process. This was all that was sticking out. The rest of that was below the gum line, and there's pus material on it. So that's a big tooth for a little rabbit, but that's not abnormal necessarily. They just have really long roots. This pretty much the whole side of her jaw on this side, unfortunately, is not going to be, we're not going to be able to save these teeth. They're all involved in this this infection that's going on. So we're going to pull the teeth on the right lower jaw for them. I don't think we'll end up saving any of them, to be honest, but I'm just going to do them one at a time until we see. The upper teeth will end up being, that's another, and that's all infection around that root. So one of the complications of this will be that the upper teeth will not have a grinding surface, and so the probability will be that they will overgrow more rapidly and will require maybe more frequent trimming than we would like to have to do, but certainly not anything that can't be taken care of. And most of them with time will sort of stop growing. Just take a little listen. Everything seems fine, but we're just going to take a quick little listen. Sounds good. That really should be a straight tooth, and you can see that it makes a little zigzag, and it's because the teeth have been under so much pressure because of the bad bite, and they're growing. That's what causes them to abscess as well. They start to grow all different directions. Same thing here. This should be a very straight tooth, but it's made a turn because of the pressure that it's been under, trying to bite down. Another tooth. Again, you can see all the infection. That should not be there. This lumps of stuff. This is really just pus. One more. And it's loose. Okay, that was the last of those molars that were infected. Well, their teeth, when they're maloccluded like this, grow to a point where they put so much pressure on one another where they try to bite down that it causes the roots to become crooked, and then it breaks down the blood supply, and then bacteria that live there naturally in the mouth will migrate down those teeth and abscess. But it generally starts because of the malocclusion, and the teeth are growing, but they're not wearing. So at some point the rabbit's mouth can only open so far, and now you've got incredible amounts of pressure. The rabbit's mouth is trying to close, and it causes those roots to undergo decay or destruction as the pressure increases. The bacteria are often just that are involved in these things are usually sort of secondary. There's usually an underlying primary cause that allows it to happen. And so although there is a bacterial component, they often are just opportunists to a situation that was created by another problem. She'll be on critical care and some oral antibiotics, as well as probably be doing some penicillin injections if Mom can, about every other day. We'll send her home with some a medication called Buprenex or buprenorphine, which is an opiate type drug that we can give every 6 to 8 hours, and probably a little bit of a medication called Medicam, which is a non-steroidal, and we'll use those in combination. We'll give her both of those before we wake her up from the sedation injectably here. So now one of the things is as we're trying to allow this to heal that we're going to be battling is stuff is going to want to get packed down in this hole, and that's always a challenge because we really would like not to close the hole because we want to allow that infectious abscess to stay open where it can drain well. So we'll be sending home, one of the other things we'll be trying to do as best we can, a little more difficult in bunnies than in dogs and cats, and that is have a little solution that we can kind of squirt back in the back of their mouth to rinse it as best we can. They're not always real good about opening their mouth and letting us do that, but we do the best we can. And rabbits are really unable to vomit, and they really need food going through it all the time as much as possible to keep their GI system healthy, and so we like to keep them on their food up until surgery. Not necessary to fast them. See that on the big screen now. Ow. So those, you can see those little sockets where the tooth roots were. Some of that stuff that looks white, that's some dead tissue. Now I've scraped a lot of it off, but a lot of it is what we're going to be, as over the next week, should sort of slough out on its own. It's still a little attached, so we can't really get it all out. But we don't want to sew that up. Otherwise we just leave it stuck in there. We leave the material down in there. So we're going to leave this whole open area where it can come out through the mouth. And generally these guys will heal from the deeper portion up towards the oral cavity itself. That's not too bad. I'm going to get a little more out of there. You can see that. That's a little bit more that I scraped out of there. Rabbits have a very thick pus material. It's not like we generally think of where it's kind of thin. It's almost like toothpaste. Okay, let's do these last upper teeth here. Mouthwash that has chlorhexidine in it, and I'll have you just kind of gently putting it back in the bottom of that mouth and squirting it. I'm not getting any pus behind it or infection behind it at the moment, but we're going to go ahead and see if we can just get it to slip out of here, because it's not really providing anything except a problem to be. Even if it isn't abscessed yet, it's not a normal tooth, and it doesn't have a normal tooth below it to help grind it anyway, so it's not going to complicate our dental issue any more than we already are. Could have been a pressure fracture from all the overgrown. That really doesn't look like the entirety of the tooth. So we'll be watching. It may actually regrow and be completely healthy. There's no infection around it right now. Looks fine. You're done.